why do I need to go to the gym? I'll become bulky. You really won't. It's not possible for you to become bulky unless you're on banned substances. That's a different thing. You will just be putting on healthier weight in the form of muscle instead of fat.
Hello and welcome to the Kidsstoppress Podcast. Today on season 4, we are welcoming our first dad of the season. He's all of 5 months old in the parenting journey. He's a debutant author. He's also a health creator and an orthopaedic surgeon. We're talking of none other than Dr. Manan Vora, who is also a health educator, co-founder of the NutriBite Wellness. He is also a PhD scholar in regenerative orthopedics and has been recognized with multiple awards, including the prestigious Edinburgh Surgery Global Scholar Award. When he's not treating joint pains, he's seen as creating some really informative and educational content on his Instagram handle, which boasts of followers of upwards of 400K. So let's welcome Dr. Manan Vora. You said a very important part of lifting weights and, doing muscle and resistance training. And I've read in the book, and we obviously have close to about 80% women on our platform between the ages of 28 to 45. And Instagram can be so deceiving when you are seeing skinny women not doing resistance training when that's what's going to hold us fort later.
Absolutely.
So talk to me about resistance training, especially for women.
Correct. I think women need it way more than men because men have a lot more testosterone that gives them that protection as well. But women, and in that age group, if they incorporate weight training and resistance training, your body will only thank you in your 50s, 60s and 70s. Post menopause, due to the hormonal changes, bone density goes down. Osteoporosis is a very common thing that can happen to women with their bone density going down, their fracture risk increasing, they get a lot of joint pains, bone issues. All of this very simple to prevent. Just lift weights as soon as possible. Start lifting weights as soon as possible. People need to understand that muscle is the currency of your body. Mm-hmm. So just how you're constantly worried that what is my portfolio looking like in the bank, whether it's your bank balance or your mutual fund or stocks portfolio, everyone keeps talking about these things in their 20s and 30s. Muscle is that amount in your body that
and
we need to worry about.
And it's only going to compound.
That's only going to compound if you show up in the gym or you lift at home or you add some resistance. It's only going to compound over time and give you those benefits as you age. At the end of the day, you need muscle to do any function in life. Mm-hmm. So when those who are skinny, they think that, oh my God, why do I need to why do I need to go to the gym? I'll become bulky. You really won't. It's not possible for you to become bulky unless you're on banned substances. That's a different thing. It's not possible for you to become actually bulky. You will just be putting on healthier weight in the form of muscle instead of fat. Right. Similarly, we have women who are overweight or even in the obese category who are just busy doing the elliptical and cardio, thinking यार मुझे तो weight कम करना है तो मैं cardio करूँगी. Please understand that cardio is cardio for your heart. It's for cardiovascular health.
Yeah.
You need to lift weight to actually burn that fat and preserve your muscle mass. Mm-hmm. Because you can go from 80 kgs to 70 kgs, but if you've lost majority muscle, that's not a healthy weight loss.
Right.
So you need to preserve your muscle mass and lose the fat. So whether you're skinny, whether you're even ideal body weight, whether you are at the other end as well, lifting weights is non-negotiable and it will be life-changing once you start.
Right. We've also had, when we shared that we're going to have you on the podcast, we also had a lot of women who said that you're now seeing women hit menopause in their early 30s, right? And they're saying that if they're already there with their bone health to that of a 60-year-old in their 30s, what can be their course of action?
Again, weights, right? So it's as simple as that. We can't keep consuming calcium supplements. That's not a solution, right? So maintaining bone density is directly proportional to the amount of resistance you give your muscles and the amount of muscle mass that you have in your body. Right. On the other end, obviously being overweight or obese is a direct inversely proportional correlation with your bone density. So try and come in an ideal body weight as possible.
Is it possible?
Absolutely
just
possible.
With strength training?
Just with strength training. It's absolutely possible. to actually mitigate all the risks and complications of lower bone density and osteoporosis only by starting weight training as early as possible. Everything else is osteoporosis management, and it starts from a simple calcium vitamin D supplementation to a calcium nasal spray to different types of medicines and drugs, but they all come later once your bone density is already lowered.
Right.
These are things you need to keep in mind to ensure your bone density doesn't get low in the first place. So 4 points would be weight training, second would be ideal body weight, third would be avoiding any steroid use of any type, and fourth is no smoking. Because
Right.
all of these four, if not followed, takes your bone density down right away.
Right.
Parenting tips, celebrity interviews, recipes, conversations with experts, DIYs, and lots more. Subscribe to Kidsstoppress now.